filler on Friday, but Saturday is being super busy with filler. We're going 3 rooms in a row already. I'm really excited because we have a really cute patient here who's never had any filler before. And here's the thing, you guys. When you're younger and everyone's telling you to do all these fillers, don't go crazy about having to get all these fillers. For her, we need to do it for shaping, and she's not going to need really a lot, just small areas, a little bit in each area. The goal is get that structure, and then we're going to start doing lasers and tightening things to give her more definition and lifting. But I want you guys to see, look up a little bit. She has this little crease that she's noticing. It's a little harder to see in this lighting, but in most lighting, and that's because she's losing volume in the middle face, yeah, perfect, and the lateral cheek. So what I want to do is let's make her cheek pop a little bit. This is an area where, honestly, girls don't even notice how important this is until we do it. Little pinches, she's doing great. I want to do, a little bit of height so she gets, that volume. And then what we're going to do is bring that over to this mid portion where it fills in that line, okay? And that helps lift her face. It's going to be really good for her. So you can see already the structure is forming. See? Daisy, you want to tap her a little bit? There you go. Perfect. So you guys see, look here now. We take a look at that one side. Look at it. It's lifted. Looks great. Not overdone at all. This is very little. And we're going to do that same thing now on the opposite side. So let's look at the height. Yeah, see already, if you look, come in real quick. If you take a look, you can already see that line that's formed. It makes that side look slimmer. So we're going to do that same thing over here again at that insertion point where the midface hits cheekbone.
Someone said, I'm 33. Do you start doing these procedures at a certain age, or is it more about when you notice you need it?
That's actually a very good question because it should be when you notice it. Because my best friend at, I think like 27 did his under eyes for surgery. And I have friends of mine growing up at 16 needed rhinoplasty. So it's not really an age thing. It just depends. Like there's young moms that lose a lot of weight or gain a lot of weight during pregnancy and their whole face changes. And so that's the thing, is it's not as much an age thing as it when you need it, but if you want to wait to a certain age to do something, you can, but it's like, what if all of a sudden you waited too late? So again, take a look now at her face. Looks great. That middle part's perfect. So now we're going to go towards actually doing a little definition of the chin. And so look up a little bit. So here's the thing, you guys. Look at her chin. She has a very strong muscle, but we want it to come out a little bit more because we want it to be, we'll have a little more of a structure. So I'm gonna go really slow. So you don't want to make her too wide or anything or too big, but we do want to bring it forward a little bit. Okay, so we take a look, and again, a 3-point technique. Just bringing the chin sort of forward and defined. She's doing great.
Someone said you don't aspirate?
Well, good question. The studies don't show that you should, actually. Take a look. So that already came forward more and looks great. So now what I'm going to do is I'm going to use a cannula so it doesn't hurt so much at all. Hold on.
Dr. Emer, no treatment in room 2.
Okay, so now.
Someone said, hi, fabulous, love you.
That's cute. Hey, where are they calling from? Or where are they coming in from? Okay, so now, let's see if we can do it with I'm gonna do the long, actually, I'm gonna do the long cannula. Hold on. Let's switch the cannula here. So this is less, did you have a lot of pain yet or no?
No pain.
Okay, good.
Pressure.
Okay, so I'm gonna use a cannula so you shouldn't feel pain at all, it just looks long. Lift and turn left, okay? So you guys, so her area here, the Marionette and chin, this is where she's starting to notice a little pre-jowling, or at least I am. Turn a little more left, there you go. So what we're gonna do, this actually will help her chin and improve the crease, is we're gonna use a cannula, so this is not painful. It just feels strange because you're moving through the tissue without pain. Hold on. Yeah, let me get that back because the skin is thick.
Someone said, I've read about fillers migrating and giving a droopy look eventually. Is this false, or does that only happen when you overdo it?
That's a good question. So that is typically false, and it only is if people overdo it, or if they use things that can cause migration. So again, for example, this integrates into her tissue and just blends the area and just softens and lifts it. It's not going to migrate anywhere. And what we just did on her chin actually will stay on the bone. So there's no way for it to move because it's literally in a space, a very specialized space. Okay, again, just doing this very little amount of filler.
They're saying she's already looking great. Yes, guys, she is.
Look up and a little left with your chin, like higher. There you go. So I want to get, again, this marionette right here. So you guys see, like right at the edge, and this is, again, with the cannula, so there's no risk. Just feels strange, again, right there. So that lifts her out her mouth corner. Perfect, okay, now go ahead and massage that side. We're gonna go the other side, and then finish. She's just gonna do a little like massaging. We're almost done. So this helps not only her chin, but also the crease. Turn a little bit that way, okay, and that. Love the cheeks, oh my God. Looks so good. So now, go ahead. We're gonna do that same thing again. Just a light blend, and I'm using Radius on her because her skin's a little bit thicker. And if we did HA down here, for the majority of this, she would really not see anything at all. Very little, she would need a lot. This Radius tends to give you much more. Good, you're doing great. Again, just kind of drawing this out to help her. And we'll go up into the area of the marionette.
How long is downtime for female facial sculpting?
None. I mean, you literally will have swelling up to 2 weeks. So I always tell people the final is 2 weeks, but you look fine the next day. Actually, look fine today. Okay. So now we're gonna do a different technique where I have to do some pokes onto her chin. So we're gonna go look up here, perfect. So now I'm gonna do across here, we're gonna do these small little depot injections. It's gonna feel a little weird. And the reason I'm doing it this way versus a cannula is then I can get this little crease that's here, and this is using Refine. Refine's a very superficial, thin filler. It allows me to get this fine amount more superficially. Sorry, honey, I know this hurts a little. And I can go all the way across. Breathe. Breathe. Good. And get this line so it doesn't look too deep. And it'll help her chin, because if you just increase, you guys, the chin, it's gonna look too projected. So we wanna get this crease right here. It's gonna look great, great, great. So you guys see how much softer already? Perfect. And then do a little bit more here to get the pre-gel, but it already looks better. Much better already. Okay, hold there for a sec. Almost done. And then I'm gonna give her just a little more height on her cheek, just because I wanted to see how that looked. I think she can go a little bit more posteriorly. So a little bit back here, just give her a little more height. I think she'll like how this pops when she is in seeing herself in her pictures and stuff. Doing okay, we're almost there. Good. Perfect. Okay, now, last one, let's see. Your mouth's gonna feel weird because there's numbing. It'll come back. The mouth feels weird, you guys, when we do this, because there is numbing that's in there. but the numbing wears off in about an hour and she should be fine. And then we're just finishing up the sculpting. The last part I have, this is gonna give her more slimming to the face, which I love, which she's gonna love actually. And then we do the lip, that's the last part. So the last part's always the best part because everyone loves when lips are done well. So now we're gonna lean her back slightly and finish with the lip. Her lip's tiny, you guys, so please don't overdo a lip like this with too much volume. Very little. Keep the lip shape the same, okay? So basically all we're gonna do is take the lip she has and just do very, very subtle. So I'm gonna show you guys here. We're gonna lift with Volbella. This is just gonna give her a little lift, see? Very little. I just wanna open the show of this lip. Okay, perfect. Breathe, we're doing great. Same thing we're gonna do here.
Someone wants to know how long the filler will last in her lips.
At least a year or sometimes 2 years. I mean, honestly, I always tell people underdo lips. Let me see. We're gonna underdo the lips. Oh, it's very cute. You're gonna love it. I like to underdo lips, you guys, because you can always add more. If you add too much, it's gonna look big and it can be bulky. So take time, take your time. I wanna give her some, but she doesn't have really much volume there, so we gotta give her some.
If she wants more, how long should she wait?
At least 2 to 4 weeks, I would say. We're gonna define her columns here because she naturally has some columns. So we're doing that. You guys can see. All right, look at that column.
There's 5 ready.
Okay, almost there. You're gonna love it.
Are fillers safe for breastfeeding mamas?
That's a good question because people will tell you don't do anything when you're pregnant or breastfeeding, but no studies have actually been done. Close for a second.
Room 5 ready.
Almost there. And I think they're completely safe. But again,
There's room 5 ready.
it's something you'd want to discuss with whichever doctor you go to and their comfort level.
There's room 5 ready.
But most people would say don't do anything when you're breastfeeding. Although I don't think it affects it. We're almost done. So you guys see this is the CC of Volbella. And it looks amazing. She's gonna love it.
Wipe one leg at a time. Do you want to do this first?
You have to wipe everything off at once. We're doing all the scars? Yeah, wipe it off. Okay, let me show you. Let me clean. Hold on, it looks amazing. It's not even bruised, which looks incredible. It's barely bleeding, not even bruised, you guys. We'll do a quick Emer reveal where I have you hold the phone. You're gonna look at yourself 45 and tell me what you think. Hopefully you like it. I haven't had anyone not like it yet on a live, but let's do it.
Alright.
So hold this, hold like that, and take a look.
Oh, wow.
What do you think?
No,
What do
I
you?
love it.
What do you? Oh, hold on.
Sorry.
I do. Come in. So you come in like bring it in. What do you think? So
Oh, I love it.
tighter
Thank you.
cheeks, pointer, kind of straighter chin with with improvement on the jawline and the corners of the mouth, and then lips.
Beautiful, thank you.
What were you expecting? Because you've never done it.
No, this is, I'm sorry.
It's okay. It's okay.
But it looks great.
Yeah,
Thank
it's
you.
good because I love you naturally have some columns. Right now it's swollen. When it all settles in, like you'll be able to notice more height.
Yeah.
You'll be able to see more straightening and softening, and then the lips have a nice amount of volume. Now let me show you here. Hold this a sec. I'm gonna show you really quick. Grab that for her, and then I'll show you in the regular mirror. I'm gonna have you lay so you can go on the red light. Oh look, I want you to see here now. Hold with the regular mirror.
Wow.
You see? So slimmer, tighter. I'll start raising you as you look. But just look slimmer, tighter, just like more contoured, you know?
Yeah, thank you.
Which is what I like, and it doesn't look overdone. So look your chin up just a little bit higher, right there. Okay, you guys, do a pan. Let them see. And then you're gonna set a red light, let all the numbing go away. That's facial sculpting, you guys. Looks really good. Okay, there you go. You guys go. Congratulations.
Thank you.